Welcome to this video on wound care and acute first aid for sports medicine settings. Our focus is on building a safe clinical thought process, prioritizing patient safety, controlling bleeding, and knowing when to escalate care. Remember to always follow local protocols and your specific scope of practice. Our learning goals include recognizing different wound types and the associated risks. We will prioritize immediate care, including scene safety and bleeding control. We will also learn to choose dressings wisely, and most importantly, know when a patient needs to be referred for higher-level care. Initial response starts with safety. Scene safety means wearing gloves and eye protection. The primary survey ensures that ABCs are addressed before wound inspection. Apply firm, direct pressure for hemostasis. Finally, expose the wound and remove hazards like rings or restrictive gear. Always treat the patient first, then the wound. The 4 goals of wound care are to stop bleeding, protect tissue, support healing, and reduce scarring. The immediate goal is safety and infection prevention. Remember that in acute care, the primary focus is not making the wound look perfect, but controlling bleeding and identifying wounds that need a higher level of care. We classify wounds by mechanism: abrasions, incisions, lacerations, punctures, and avulsions. The mechanism is important because it predicts contamination, depth, and the potential for hidden structural injury. For instance, a deep puncture carries a high contamination risk. A focused history should ask what changes management. Key details include symptoms, force, contamination, and foreign body potential. We also check timing, tetanus status, medications, and any history of abnormal scarring. The history helps determine if the wound is routine, contaminated, or potentially dangerous. A systematic wound examination looks beyond the surface. Document the location, size, and shape, and look closely at the depth for fat, tendon, or bone. Assess neurovascular status, checking sensation, movement, and pulse. Documentation is critical and should cover care provided, reassessment, and any referral decisions. Refer or escalate care when risk is high. Red flags include open fractures, joint involvement, visible tendon, loss of function, deep punctures, bite wounds, and uncontrolled bleeding. When in doubt, refer. The cost of under-triage is always higher than over-triage. When cleaning a wound, irrigate, don't irritate. Rinse the wound with clean running water or saline. Wash around the wound with soap, but avoid applying harsh chemicals like hydrogen peroxide or iodine directly to the wound bed, as they can irritate tissue. The minor wound cleaning workflow includes gloves and hand hygiene, then controlling bleeding with direct pressure. Next, irrigate the wound and remove loose debris. After cleaning, dress and protect the wound based on its needs. Finally, monitor the wound for signs of infection and reassess return to play. Do not close high-risk wounds on the sideline. Picking a dressing depends on what the wound needs. Rehydrate if too dry, absorb if there's heavy exudate, or protect from friction. The key is maintaining moisture balance, avoiding a wound bed that is either too wet or too dry to support proper healing. Common dressing categories include hydrogel for dry wounds, alginate for absorption, hydrocolloid for protection, foam for cushioning, and non-adherent layers for fragile tissue. Selection must be based on wound depth, drainage, location, contamination, and the follow-up plan. For life-threatening external bleeding, expose the wound and apply firm, direct pressure. Use a dressing, adding a hemostatic one if available. If pressure fails, use a tourniquet or perform wound packing only when indicated and properly trained. Severe bleeding is an emergency situation. Arterial bleeding is typically bright red and may spurt, quickly becoming life-threatening. Venous bleeding is darker red and can flow rapidly. Focus on the severity of the bleeding and rate of blood loss, not just the color, to determine the urgency of care. Closure should only be considered for superficial, clean wounds with controlled bleeding. If you can align the edges without tension, use steri strips or butterfly closure, if allowed by protocol. Refer instead of closing bite wounds, deep punctures, gaping wounds, or if there's any uncertainty about depth or underlying structures. Closure is a clinical decision, not a cosmetic shortcut. For facial lacerations, seat the athlete, apply sterile gauze and direct pressure. Refer for concerns like gaping edges, cosmetic issues, or if eye structures are involved. For epistaxis, or a nosebleed, lean the patient forward, pinch the soft part of the nose for 5 to 10 minutes, and escalate if bleeding persists or breathing is difficult. When dealing with eye injuries, protect vision and do not improvise. Different injuries require different actions. Chemical exposure requires immediate flushing with water and urgent evaluation to protect the patient's vision. Eye injury first aid varies by type. For a blow to the eye, use a cold compress, but avoid pressing on the globe. For a loose object, blink or irrigate with clean water. For an embedded object, do not remove it. Stabilize and activate emergency care. For chemical exposure, flush for at least 20 minutes and seek urgent care. Vision changes always require referral. For an avulsed permanent tooth, handle it by the crown, not the root, to preserve the root ligament. Gently rinse if dirty, and reimplant only if trained and appropriate. Otherwise, store the tooth in milk, saline, or saliva, and seek immediate dental care. Never store an avulsed tooth dry. Be aware of internal bleeding and shock. Look past the skin for signs like abdominal or chest trauma, worsening pain, pale/clammy skin, rapid pulse, or collapse. Immediate actions include activating EMS, keeping the patient still and lying down, monitoring vital signs, and treating for shock. Animal bites carry a high risk of contamination. Always wear PPE and control bleeding. Wash thoroughly with soap and water, and apply antibiotic ointment for minor wounds. Refer for deep wounds, punctures, or wounds to the hand or face, and follow protocols for rabies or tetanus concerns. Do not try to capture the animal. For a venomous snake bite, the rule is to do less, faster. Activate EMS immediately. Keep the person calm and still, and remove any tight clothing or jewelry. Immobilize the limb and note the snake's appearance from a safe distance. Do not apply ice, cut, suction, or use a tourniquet. For bee or wasp stings, scrape away the stinger and monitor for anaphylaxis. For ticks, grasp close to the skin with tweezers and pull steadily. For all bites and stings, watch for severe symptoms. And remember that anaphylaxis is an emergency that requires immediate intervention. For poison ivy, oak, or sumac exposure, wash exposed skin and clothing immediately to remove the plant oil. Use cool compresses or anti-itch lotions for relief. Seek medical care for severe rashes, especially if involving the face, eyes, or genitals, or if signs of infection appear. We use a case framework to practice clinical reasoning, starting with the mechanism, followed by scene safety, bleeding control, cleaning, dressing/closure, and finally, the referral decision. A strong clinical answer explains the why, not just the procedure. Here are some quick quiz prompts to reinforce key concepts. Think about which wounds shouldn't be closed on the sideline, and what 3 things trigger a referral for a laceration. Also, remember the first step for life-threatening bleeding and how to treat an embedded eye object or an avulsed tooth. Remember these key takeaways. ABCs come before wound care. Clean gently using irrigation. Refer early for high-risk or uncertain wounds. And know the specific protocols for environmental risks like bites and stings. Proper immediate care reduces risk and improves outcomes. This video was adapted from an existing wound care sources and supported by resources from the American Heart Association, American Red Cross, Mayo Clinic, and the CDC. Please consult your local medical direction and protocols, as this video is for educational purposes only.